As I said, this is a very long list, and we definitely thank them. But notably, part of this is both the professional organizations, which are the usual people, the Ontario Health Quality Council. You want to get all the prescribers and the nurses together. But the interesting thing is to try and get those pharmacies on board, right? That's something that I thought was really a step forward. So just going to go back to the case, just to look at this again with your jaundiced eye of what happens in Ontario, right? This 92-year-old woman, who shall remain nameless, is being treated with very common drugs. Furosemide wasn't on the list this time. So very common drugs. A lot of them have been evidence-based. Some of them are symptom-based, and some of them might be listed on the Beers list. At the bottom, the 12 medications might be a measure of a poorer quality of care, maybe not. And that's what we can argue about for sure. The summary points just for today, just to remind you what I want to talk about. Many medications prescribed in long-term care are likely evidence-based. That's not what I'm saying here. Many medications prescribed in long-term care are likely symptom-based, and we know about that. Some medications prescribed in long-term care are potentially inappropriate and may be harmful. And the long-term care community is working towards standardization, reporting, and quality improvement. And you'll be hearing a lot more about that later. So today, I just want to remind you what the objectives for today were to describe some of those common medications, to present a metric of the prescription of 9 or more medications, and to compare this measure with some other measures of quality. There are a lot of people to acknowledge in some of the work. Susan Bronskill has really been instrumental in spearheading a lot of the 9+ medication and on a lot of these grants, including Sudeep Gill and Mike Patterson at ISIS, Paula Rashan and Jeff Anderson, who are both at U of T and ISIS, Rebecca Comrie, who's now at the OHQC, used to be at ISIS, Stacey Brenner, who's also involved in it, who's at U of T, and Chris Wichman, and Paula Neves, who's really spearheading this new movement for the intervention. So thank you very much, and look forward to your comments.